Cases of Omicron are starting to wane across the state of Indiana, and so are the number of Hoosiers heading to COVID clinics. Whether it's for the vaccine or a test, what was an overwhelming demand is now drastically declining. Tonight, our Lauren Kostick looks into what's driving this sudden change and how it's impacting clinic availability.
All right, big breath in, exhale it out.
Next Friday, the vaccine clinic at the 4-H Fairgrounds in Hamilton County will be shutting its doors.
In an effort to free up space and right size our operation, we're opting to move back to our office.
At its peak, the clinic served about 400 people a day, but recently it's been seeing less than 100.
Where we get the initial interest in it and then it starts tapering off after that.
And it's not just vaccines. Many counties are also seeing a decline in testing.
It has been going down just as fast as it came up.
For months, Fisher's Health Department was slammed with appointments, but now it's a lot easier to find a time slot.
It was frustrating when we couldn't offer that every day, but we're glad that we're back in a position where that's not such a critical need right now.
And this drop in demand comes as cases fall across the state.
Therefore, testing is dropping. Fewer people are becoming infected, thus fewer people are symptomatic.
But he says another driver in this decline is the widespread availability of at-home tests.
It's so much more convenient to walk to the medicine cabinet and grab an at-home test now than it is to drive, to a site and wait in line.
But many times those results go unreported, which can be problematic for tracking the virus and emerging variants.
We could miss, or at least initially miss, a variant or something, a beginning of a spike in a community or in a state, for instance.
The state has previously said there is no way to verify an at-home test was performed correctly and given accurate results, saying the number of cases reported will always be lower than the actual total.
Let me show you just how far COVID cases have fallen here in Indiana. Look at the dip that we've seen here in the last week. Quite a drop. In fact, yesterday we reported about 2,000 new COVID cases. Now keep in mind that number is especially low because it was a weekend, but on average you see that we're back to the numbers that we were getting back in mid-December, and that's before Omicron really took off. And we are consistently below the 10 to 15,000 daily cases that we were seeing repeatedly. Keep in mind, as Lauren mentioned, the real number of infections is almost certainly higher than this, though, because of all the rise that we've seen in rapid at-home tests. We've got a link to the state's website. That's where they track all the data. If you'd like to take a closer look, just head over to WTHR.com/coronavirus.